Hi guys, I'm Dr. Brown. I got an email from a lady named Mary, and she had a couple different questions, and this question's kind of came up quite a few times with a number of people. So I wanted to kind of answer this, and I'm going to try to do this in 2 or 3 parts to this. So you'll need to look for probably 2 or 3, 4 videos that are going to be in sequence to this. But this lady Mary, she specifically asked, why do people not really know a lot about naturopathic doctors? Who are they? How much schooling do they go to? Why when I get diagnosed or I'm going to my medical doctor, why do they not tell us about natural medicine? The second part that we're going to discuss on probably part 2 or part 3 of this video is when you get diagnosed with something, what are the steps that you will do or the steps that you'll take to actually move forward with trying to go forward with treatment, both from a conventional standpoint and a naturopathic standpoint, and how those things can be intertwined. And then the third part into video 3, 4, or 5 essentially will be, how do you combine your naturopathic doctor and natural medicine and alternative treatments with your conventional doctor with the conventional therapies? What's the proper way to do that? What's the improper way to do that? And why do some medical doctors not want you seeing a naturopathic doctor or doing certain alternative treatments? And what are those reasons? So we're going to try to get into all these topics here. So let's start with the first thing here. So why are people unaware of naturopathic doctors and their experience? The problem is that when, unfortunately, here in the United States, if you track back 100 to 150, even 200 years ago here in the United States, there were naturopathic doctors, and there was herbal medicine, there were Native American Indians that were here in the United States, and you can go back as far as Chinese medicine, where all of these different modalities like acupuncture and using different herbs and making herbal teas and things like this existed. When you fast forward into the early 1900s and going up to 1920, 1930 into 1940s, we started, we developed a microscope, we started looking at bacteria and viruses and things of that nature in labs, and we started creating antibiotics. And at that point, this is essentially when medical doctors came onto the scene of, we're a medical doctor, and if you have a certain bacteria or a certain fungal infection, we're going to prescribe a certain antibiotic to get rid of that, which is all fine and dandy if that's the problem that you have. So as this transpired over the last essentially 60, 70, 80 years or so, what has happened is that mainstream medicine has become mainly about not so much of anything about herbal medicine, but it's really transformed into this, let's give somebody a drug for whatever they have. And obviously, as most of us are aware of, the pharmaceutical companies, who have arguably 2 to 3 lobbyists per Senate member or Congress member in Washington, they are really pushing the drug therapies, and they're pushing the pharmaceutical medication in with people. So when people are asking, why don't we hear of what a naturopathic doctor is and what is their experience? Well, the reason is that insurance plans here in the United States have only been accepting MDs and DOs, and mostly that's MDs. And so when you go to the hospital, you go to your primary care doctor, if you happen to have Blue Cross Blue Shield, you happen to have United Healthcare, or whatever your insurance company ends up being, they're usually going to tell you that if you're looking for a primary care doctor, you can go to these couple. If you're looking for a dermatologist, you're able to go to these 2. So most people are not being even told about naturopathic doctors or naturopathic medicine because it's simply not based on most people's insurance plan. And Mary, I hope that answers your question, is that it's not that there's not naturopathic doctors everywhere. If you look in every state in the United States, there are naturopathic doctors there. The unfortunate problem is that because of a lot of the bureaucracy and the legal aspects that have went along with this program of medicine over the last 60 or 70 years, there is not a full licensure, or in some states, there's no licensure for naturopathic doctors. So yes, there are naturopathic doctors in those states, but the licensure is not there. And that's one of the main reasons why you are not hearing widely about naturopathic doctors and naturopathic and herbal medicine or alternative treatments. It's not that we don't exist. It's not that we don't go to 4 years of a naturopathic approved and licensed medical school. It's just that when you look at the insurance program and how that's fit into the conventional medical society here in the United States, that is the reason why you don't hear a lot of naturopathic doctors. But if you get on the internet, For example, here's my website. I pulled this up here previous to this video so you could take a quick look at it. But if you go to www.drjoebrown.com, and that's doctor spelled out, drjoebrown.com, you can search my name or my website and you will find both a bunch of information about me. I work with a lot of the conventional hospitals and conventional doctors. A lot of them are my colleagues and friends. So it's not that naturopathic doctors like myself are not out there. We've been here for a long time, and a lot of us, like myself, we work in the hospitals or with the hospitals and the clinics. But you are not going to be told that from your primary care doctors because they are essentially doing and dictating what insurance has dictated to them. So I hope that answers your question, Mary, and we're going to get to parts 2, 3, 4, as many videos as this takes to get to all your guys' questions. So that's part 1. Again, if you need more information from me, you can go to drjoebrown.com, or my direct phone number here at the office is 480-456-8600. Thank you.